Hi everyone, my name's Kath McIntyre and I'm from the Australian Telehealth Society, and I would just like to acknowledge the traditional owners of the land on which we meet today and recognise their continuing connection to land, waters and culture, and I pay my respects to elders past and present, and I extend that respect to other First Nations people with us today. So today we're in conversation with Keshia De Guzman, who's a postdoctoral research fellow. Thank you, Keshia, for being with us.
Thank you for having me.
And Sharon Gannon is here. Sharon's an experienced registered nurse and owner-director of Sharon Gannon Solutions, and she's got extensive experience in public and private health services sectors and in government. So we thought we'd do these in conversations to catch up with people who had presented papers at the Success and Failures in Telehealth conference last year, so we can catch up on some updates on how you're going with your work. So I will hand it over to you, Sharon.
Thanks very much, Kath. So, Keshia, it's so wonderful to have this opportunity to speak with you. This is an area of a great passion of mine, having telehealth and general practice working so closely together. And from memory of what I've heard about your presentation last year at SFT 22, you had a lot of interesting data and I think a lot of passion behind what you were presenting. So what I'd like to kick this little session off with is the opportunity to ask you to give just a short summary of what you presented last year, knowing that we will be able to hopefully use some of your infographics and so on in our websites and so on later on. So over to you for a few minutes. Thank you.
No, thank you. Thank you for your interest in my work, and it's kind of nice to know that, you know, when you do this research and you work on these studies, that, you know, people are interested to hear about it, and hopefully it has impacts beyond the research community. So I guess it's probably easiest to maybe just start with that what I presented last year at SFT was one of the studies that fell under my overall PhD. So just very, very briefly, my PhD was focused on telehealth use in general practice. And really, as part of my program of work, I was looking at economic factors and clinician drivers that impact telehealth use in the general practice sector. That was kind of the overarching, I guess, theme of that program of work. Last year, I presented on a specific study, which was really looking at the MBS data. So in other words, data from the Medicare Benefits Schedule in terms of what was happening with GP service volume and the costs that were associated with GP services during the pandemic. And as you would well know, and I think a lot of people that are part of this society, that during the pandemic, there was just, you know, this exponential increase of telehealth services. It was something that was really, really needed. And so as a result of that, what happened was the Australian government introduced a lot of funding to provide those services. And I think, as you would probably know, Sharon, in the general practice area, there really wasn't a lot of funding for telehealth services for GPs to provide care directly to their patients before the pandemic. And so when all of that was introduced, there was suddenly this opportunity to be able to do that. And so my study last year was really looking at, well, how did that policy change of introducing all of that funding actually impact activity and costs? And I want to preface first, before I kind of talk just on some of the key findings, is that this is still an evolving situation. And the data that I looked at, that was over about 5 years, but we do need to, well, we need longer term data to really see whether those trends are actually going to continue. So in a nutshell, really what my study found was that after the introduction of all of that additional funding, we saw an increase in GP service volume. It's probably not that surprising because we introduced the funding and naturally, you know, we saw an increase in telehealth services, so phone and video conference consultations. And then with that, there was an increase in costs. So the increase in cost was approximately 7% more overall per month as a result of that funding being introduced. So it seems like, I guess, it's a bit of a contentious kind of topic because when we talk about increased costs, people and the government and people get very worried because they're like, okay, well, we're spending more, right? But what we really need to do now, and what my study wasn't able to do, is really look at how the value of those services are achieved. So yes, we had an increase in service volume for telehealth and in-person activity.
Yes.
It's hard to decipher whether that difference was just due to the policy changes. Obviously, there would be a pandemic effect in there. And so again, we need to see what's happening when the pandemic kind of settles.
Yes.
But whether that increase in costs and services actually does translate to improved outcomes, right? So if we have better care from GPs are able to provide telehealth care to their patients, that can actually improve some of the continuity of care going forward, and potentially people, coming into hospital and that sort of thing. So that's really kind of where it's at now, with looking at what those longer term outcomes are.
Right. For me, the value of telehealth in general practice is the continuity of care.
Yeah.
And that ability to connect for the consumer to be able to connect in a safe, in their own home, which is hopefully safe, but in their own home, without having to go out. For example, an elderly person having to go out with a carer, wheelie walkers, things, chaos everywhere for them. It's a big event, but to be able to do a telehealth consultation with their GP is just so much safer and easier. And what I understand, and it's interesting about the 7% increase in costs, is there any work happening about the benefit, the savings for the consumer, for example? So I'm up in Coffs Harbour today, and I'm up here is helping a 93-year-old nun who is unwell. And in order to get her to go to a doctor, if I weren't here, there's the cost of the carer and the transport costs and the time, she has to pay for it out of her care. Whereas if she was able to do it at home, there's nothing. And it's safer.
Yeah, absolutely.
Out and about. So is there work happening about that, Keshia?
Yeah, so there is. So my PhD was mainly focused on the healthcare system perspective. So, from a healthcare system perspective, yes, we see an increase in costs, but that does not factor in, like you said, the patient perspective, the societal impact of providing those services. So that's definitely future research in this area. From a wider telehealth landscape, a lot of my colleagues have done work in looking at the patient perspective and the costs that are associated with that. And as you said, there is strong literature to support that, patients not needing to travel saves costs for them, obviously from travel costs, but even some of those wider benefits as well. So if they're, able to do a telehealth consult from home, they're probably less likely to miss work. It means that they're less likely to have productivity losses, and that actually has wider societal cost savings. So absolutely, there is work that supports that. But yeah, in terms of my research, I wasn't able to pull all of those things in, but there is literature and there is work being done in that space. Absolutely.
Right. That's great. Well, I think your work was fantastic. As I said, I was very, very excited. So what's been happening since, well, first of all, the Successes and Failures 22 conference. Did you enjoy attending? Did you learn from others? And would you want to go to the next one, for example? Or have you been in contact with any other presenters that you didn't know prior to the conference?
So I'm going this year. So I feel like you're preaching to the choir. Yeah, so I will be attending the conference this year. Last year was a bit different because I attended as a PhD student. And so, you're excited to share your work. You're really taking in everything. So I think for me, from that perspective, it was just, in a PhD, you're in your own world because you have your own project and you're so focused on it. But the conference is an opportunity to see all the work that people do, not just in the general practice space, but across disciplines. Yes. And so I really, that was a real eye-opener for me, I think, to step outside of my PhD. So I think this year will be a little bit different. I'll probably be able to enjoy it a lot more. I'll be a lot less nervous. And so I think, and there's always opportunities for networking too. I met a GP that worked up in a more rural area, and they were talking to me about their work up there. It's just an opportunity to hear what other people are doing. And and, you know, have that potential if there are future projects that come up that you can sort of be like, oh, I met that person and they might be interested. And so, yeah,
Good.
Of course.
Excellent. So what are you working on at the moment? Because I know that there's been a bit of a change for you.
Yeah, so at the moment, I'm still doing work at the Centre for Online Health, finishing off some of my PhD studies. So that work around the quantifying service activity and cost was some of my earlier work. So now I'm kind of wrapping up some of my later work, which was taking deeper dives into the reasons why why we were seeing some of those activity and cost increases. So at the moment, I'm finishing up one of the surveys that I worked on. So surveys asking about GPs' preferences around delivering telehealth. And I also, after that presentation last year, was wrapping up some of my qualitative findings as well. And I think those studies were quite valuable because they, you know, I love numbers, don't get me wrong, but there's not a lot that you can get from it, right? Like if you talk to people, you'll hear reasons why, you know, these trends were happening. And so really I'm trying to wrap up a lot of that and get that out there, I guess.
That's really great. That's exciting. So will you be presenting that this year? Any of that work?
Yep.
Good.
So yeah, so I'm really excited. So this year I'll be presenting the findings from my last PhD study. And so that was the survey that was looking at GP preferences for various consultation modes. So that's what I'll be presenting at the end of the year. It would have been nice to also present some of the qualitative work because there were some really rich findings around that. But yeah.
Well, it'll be the one the year after. So there you go. You'll have an opportunity.
Yeah, exactly.
Cool. We've talked about your new work. We've talked about what you presented. The 7% increase was interesting. I'll be quite interested to read that again. And I think we might just hand you back to Kath, if that's okay. Are you there, Kath?
I am.
I am.
Yeah. That was really good, Keshia. Thank you so much. And we look forward to seeing you at SFT this year.
Yeah, no, I'm really excited. It's kind of nice to see a lot of the work come to fruition, I guess. And like, I don't know, as part of a PhD, you have so many different studies looking at different things, but pulling all of that together is really, really nice. So having some of the quantitative work with the qualitative work is really, yeah, I think it kind of shows a more holistic picture of what's happening rather than just, you know, here's the data, here's the numbers, but, you know, why are those numbers happening? Yeah, and some of the reasons behind that.
Most definitely. So thank you both very much. If anyone would like to become a member of the Australian Telehealth Society, they can definitely email us at aths.org.au. Thank you both again and see you at SFT.
Thanks, Kath. Thanks, Sharon.
Bye-bye.